But if you're 10 days in, 14 days in, and you haven't tried any medicine, it would be very unwise to just start on an antibiotic because you might get it all improved with just some decongestant medication and anti-inflammatories. Hi, I'm Dr. Josh. I'm a board-certified family physician, father of 3, nutrition revolutionary, and owner of a direct primary care clinic called Independent Family Doctors in Boise, Idaho and Caldwell, Idaho. My goal in making these videos is to educate and empower you to be a huge player in your healthcare. Let's dive in. Before we jump to antibiotic treatment for a sinus infection, you want to make sure that you've tried to control your allergies, tried to control the inflammation that comes from either allergies or a cough cold, and tried to decongest. And if you've done those things for several days, 2-3 days, and you're not getting any better, depending on the time frame, it may be time to jump to an antibiotic. The main way to help your symptoms if you're in those first few days would be a regimen of ibuprofen and Tylenol to help with the pain and the inflammation. Those medications are immensely helpful. Now, if you're super congested, you're socked in and you're speaking very nasally, like me. I speak nasally all the time. Luckily, I don't always have a sinus infection. But so that particular socked in sensation, really congested, you might need a decongestant medication as well. So that would be either Afrin nasal spray or pseudoephedrine. You can use pseudoephedrine, the one that you have to talk to the pharmacist and show them your driver's license to be able to get it. So one of the two main ones, Afrin or pseudoephedrine, fantastic decongestant. Now, most people think that Mucinex is a decongestant. That's a med called guaifenesin. Some Mucinex products have phenylephrine in them, so they might help a little bit. But Mucinex, the guaifenesin medication, is not a nasal decongestant medication. It is an expectorant, which just means loosens mucus, okay? And that's usually best help for something way down in your chest, like an early pneumonia or something. So let's not misuse that one. It really won't help very much, okay? But ibuprofen, Tylenol plus Afrin or pseudoephedrine, fantastic for nasal decongestant. If you're in the first few days and you're wondering whether this might just be allergies, then you could try some as-needed allergy treatment like Claritin or Zyrtec, or even make sure that you're using your nasal steroid spray for your allergies like Flonase or Nasonex or Rhinocort or something like that. But if you're 10 days in, 14 days in, and you haven't tried any medicine, it would be very unwise to just start on an antibiotic because you might get it all improved with just some decongestant medication and anti-inflammatories. If you've had terribly controlled allergies, you forgot to be taking your medicine the last 2 months, and all of a sudden you have 2 or 3 days of terrible sinus pressure, you could have a bacterial infection. Usually it comes with a fever as well. Sinus pressure from allergies, treat with allergy meds. Sinus pressure from a cough cold, treat with anti-inflammatories. Sinus pressure from either of those that lasts too long and you can't get it fixed with the anti-inflammatories or decongestants, consider a bacterial infection and maybe have antibiotics for that.